I'm Dr. Baxter Bell for 101 Years. I was just reading a little account of a good friend of mine who not only developed frozen shoulder in one shoulder, but a year later she got it in the other shoulder. So if you're dealing with stiffness or pain in your shoulders, it might be this condition called frozen shoulder. There are other technical terms for it, but basically what happens is the tissues around the joint start to kind of cement down a little bit and start to prevent your full range of motion, and they can also cause pain as well. So I want to share with you some ideas I have about how you can work with yoga and the frozen shoulder to improve your range of motion and potentially speed up the healing process. Before I get into that, I do want to caution you though, frozen shoulder can take a long time to get better. On average, the healing time from frozen shoulder with even very conservative Western approaches is sometimes 6 months to a full year. So you have to actually cultivate patience as you work through this problem, and yoga actually is very helpful with that because some of the meditation practices that are going to be available to you on this app are also going to be very helpful in your healing process. So one of the things we want to do when we're working with frozen shoulder is we want to be aware that we may have to limit our movement a little bit depending on how tight those tissues are inside the joint. Okay, so we may have to do modified versions of some of these things initially, and as you begin to improve, you'll be able to go further and further in terms of the movement at the joint. So let's start by some very simple things that can be very helpful, and that is what I like to call the shoulder rolls. So the shoulder rolls will mobilize the shoulder blade, the collarbone, and the arm bone, and all the muscles and tissues around the upper shoulder area. We're going to start by drawing the shoulders back a little bit, and then up, and then forward and down. Back and up, and forward and down. So I'm going slowly at first so you can kind of get a rhythm of this, back and up and forward and down, but eventually you can make that a smoother movement. And I usually do this for 6 to 8 rounds of rotation before I change directions. So I'm going to do about another 3 or 4 rounds of shoulder rolls back, up, forward, and down. Nice and smooth and easy. And you know, if this is challenging, make it smaller. So you might make the movement a little bit smaller if the tightness and the pain is limiting you on one side or the other. Usually folks won't have frozen shoulder on both shoulders simultaneously. So you're probably going to be dealing with the right side or the left side, but it's good to move both shoulders at the same time. Then pause for a moment and then go the opposite direction. So you're going to go forward, up, back and down. Forward, up, back and down. And be really deliberate, because I've noticed that a lot of times my clients, my patients, and my students will get a little confused by this one. So be very deliberate in circling around in that fashion. And again, about 6 to 8 revolutions will do you good service. So after you've done that, set the shoulders back and down so that you're not assuming a modern slump to the chest. So we're really going to encourage not a military feeling, but kind of just a balanced feeling where there's a nice broadness at the front and the back of the chest, and the arms are relaxing down to your sides. In addition, a little movement of the neck can be helpful, so you can do your owl turns, inhaling to one side, exhaling to center, inhaling to the other side, and exhaling to center. And you can do your curious dog tips, inhaling the ear to one side and exhaling it to center, inhaling your ear to the other side and exhaling it to center. And finally, you can do the big yes. You can exhale your chin to your breastbone, and you can inhale the chin up towards the sky, exhaling to the breastbone and inhaling to the sky. Let's do that little series one more time. Inhaling, turning your head to the right, exhaling to center, inhale, turning your head to the left, exhaling to center, inhale your right ear to your right shoulder, exhaling to center, inhale your left ear to your left shoulder, exhaling to center, exhaling the chin to the chest, inhaling the chin to the sky. Good, and after you're done, you might just move the head around in some free-form movement. Let's take the arms and move them a little bit dynamically just to see where we can take them today. So if you hit a hot spot or you trigger some pain, stop right there, and maybe let the other arm stop there as well. So for instance, if we're bringing the arms forward and up and we hit this spot and things get stuck and painful, stop there. And then exhale and bring your arms down. Good. Try it out to the side and see how far you can get. Inhaling up and out. Maybe you get to about the 3/4 mark and that's where you hit your tight spot. Work to the tight spot, the painful spot, and then exhale back down. And then maybe pick a spot halfway between those two, where it's a little bit out to your sides, stopping when you hit that tight spot, that painful spot, and then exhaling down. So those are some seated things you can do. The next little series is a really great one, and you're going to do this over the course of many, many days. So you're going to come down. You can move your block, if you have your makeshift block, out of the way. You can move your blanket or your towel, whatever you found in the house to work with, out of the way. And you're going to lie down. I'm on a sticky mat, but you could lie down on some carpeting or any other surface that feels good. And you're going to come fairly close. And then you're going to put your hands, and this action is the challenging action for most people with frozen shoulder. You're going to grab onto the front leg of the chair, and you're just going to move your body forward away from the chair until you feel tightness and some discomfort. And then you're going to stay there for a full minute. You're going to breathe in and out smoothly in that spot of mild but definite discomfort until you've completed a full minute to a minute and a half of breathing. If it's okay with you, you can do it for 2 minutes if you want, but be reasonable. If it starts to get too intense, you'll release your arms down. And so you want to make a mental note of where you were with your hands and with your shoulders, so that when you release your arms down, you can recall that distance and you can go a little further the next day. So the next day or 2 days later, I'm going to scoot forward a little bit. My hands are in the same spot in the chair, but now my arms have gone a little more into extension. And I'm going to hang out there for about a full minute. I'm going to breathe smoothly. I'm going to keep my neck relaxed. And after I've done 1 minute to 2 minutes, however long that takes for you, however many breaths that is, when you hit that magic number, then you're going to release your arms down to your sides. Now, you may find that some days you have to stay at the same distance that you were at for 3 or 4 days. The shoulder's just really talking to you at that spot. For people with frozen shoulder, you'll often have to work through some discomfort. It's not going to probably be a pain-free process. But the longer you stick with it, the more you work with it consistently, the more you'll be able to regain your full range of motion. Eventually, you'll be almost completely away from the chair and your arms will be completely straight and out, parallel with the floor. That could take a couple months. My good friend who went through this process, it took her about 7-8 months to get the one side back into order, then the other side flared up. It took her another 7 or 8 months to get that in order, but she's back doing her full yoga practice with inversions and headstands and shoulder stands, so the arms are able to move through their full range of motion without pain. So be patient. I would finish up your practice with the relaxing breath by clicking on that part of our app now. And as always, it's been great to have you here. I look forward to seeing you again on another topic. Namaste.